From WisPolitics in Madison, you're listening to Capital Chats.
It's Capital Chats. I'm Megan Woolard, a reporter for WisPolitics. This week, I spoke with Jennie Mauer, Executive Director of the Wisconsin Head Start Association. I spoke to Jennie about a proposal from the Department of Health Services that would alter Head Start program requirements as well as past changes at the federal level impacting work in Wisconsin. I hope you enjoy.
Hey, Jennie. Well, thanks again for taking some time to chat with me today.
Yeah, my pleasure.
I was hoping we could just start with a baseline of what do you do in your role as executive director?
Yeah. So I'm executive director of the Wisconsin Head Start Association. So we're a voluntary membership association supporting the state's 42 Head Start programs. And so I think for the general public, you might think of it like a trade organization where we do training and technical assistance, provide networking opportunities. But a lot of our time for our small association is working to provide support, guidance, and advocacy around policy issues at both the state and federal level. And as you might imagine, it's been quite intense, really, frankly, since COVID with a really rapidly changing policy and environment. So we provide a lot of support to our members to help them make sense of what's happening in the policy world.
Mm-hmm. Yeah, I was also going to ask you a bit about how the federal Head Start program being administered in Wisconsin and kind of how all that works and what role you guys play in helping providers.
Yeah, so Head Start is a bit unique in the federal funding landscape. For many federal programs, the money moves from the federal government to a state agency, and then the state agency administers that funding, often by a grant or through the counties. And so Head Start is different. The money moves directly from the federal government, so in this case from the Administration of Children and Families and the Office of Head Start, directly to Head Start grantees. So here in Dane County, that money is granted through a competitive process at its inception. And Reach Dane, again here in Dane County, is the Head Start grantee in our county. Up north, same process to Family Forum. So it moves directly from the federal government to the local grant, which is quite a bit different than a lot of other funding sources. And so again, the members participate. So our members are Head Start grantees, and they participate voluntarily with our association. But we, the association, interact quite a bit with our grantees, providing them that support and technical assistance and policy information.
Mm-hmm. Kind of on, the policy lane, that new proposal from DHS, that was released earlier this month that, kind of would change some of the federal requirements for this program. What do you make of this proposal, and, what have you been hearing from providers on how it would affect their programs?
Yeah, so maybe just to kind of level set where we're at in this process. So, Head Start is authorized by an act of Congress, so there's a Head Start Act, and that provides some of the kind of big picture guidance for how Head Start runs, and then there are supporting rules, so the Head Start program performance standards, and those have been revised several times over many years, and what came out now 2 weeks ago, time is a little fluid, was the technical term is a notice of proposed rulemaking. So right now, I think it's important for folks to know that this is a proposal. It's not final. And there's a 60-day comment period for anyone can comment, whether you're just an interested party or if you work in Head Start or receive services from Head Start. So this is a proposal. And this proposal is really a sweeping rule change for Head Start. It's eliminating the bulk of the performance standards that provide the guidance or the manual for how Head Start runs. And we are the association are really uncomfortable and oppose this rule change because it really, we believe it will dramatically erode the quality and impact of the proposal or of the program and really deteriorate services for kids and families who really desperately need them across our state.
Mm-hmm. What are some of kind of the requirements or changes that stand out that would, kind of lessen that impact of the program?
Yeah, so one of the really big changes is that it is eliminating the teacher-child ratios. I think the way that they're framing this proposal is talking about giving flexibility. And, flexibility sounds really great, but when it comes to teacher-child ratios, we know that teacher-child ratios are not just about keeping kids safe in the classroom. It's also, and safety is, of course, our number one priority, but it's also about that nurturing relationship with young children. It's about the opportunity to sit and read books, to have that interactive play. And so the proposal to completely eliminate ratios per the federal standards is alarming. Now, Wisconsin does have, relative to its peers across the country, Wisconsin has child care licensing ratios. So part of this change, if it is enacted, would require programs to comply with their state child care licensing ratios. So Wisconsin does have robust ratios, but they're still much higher. So more children per adult is in the Wisconsin licensing rules. And what we know about Head Start kids is they're coming into the Head Start classroom oftentimes with a number of different challenging behaviors. They have a lot going on at home. And a 3-year-old or 4-year-old doesn't come into a Head Start classroom and say, I'm having a bad day. There's complicated things happening at my house. I didn't get to eat last night before I went to bed. A 4-year-old comes into a classroom and they might be hitting, or they might be throwing things, or they might be biting. And that kiddo isn't a bad kid, but they're a child that needs more support. They need more one-on-one attention to really support their growth and development. And if there are more kids packed into a classroom, that's going to mean less one-on-one attention for that child that's coming in with, sometimes complex trauma or a speech delay. So it's really going to deteriorate the ability of the classroom to, again, just be safe, but also to really build that young child's brain, both, to start school and for the rest of their life, because this is such a critical time in a child's development.
Mm-hmm.
I'll pause there. I know it's hard when you can't see me and we're talking.
Yeah, I try my best to figure it out here, I also kind of wanted to ask you a bit about, obviously this program is administered statewide, but, Wisconsin as a state is, not a monolith. Are there certain parts of the state or different communities that could be disproportionately impacted by these proposed changes?
Yeah, I think that's a good question. So Head Start is present in our largest urban centers in Milwaukee, Madison, Green Bay, et cetera. But then Head Start is also operating in some very rural communities where it's the service area for a grantee is really spread out. And what I am really concerned about, particularly for rural Wisconsin, is the ability of the program to absorb these kinds of changes in really small communities where the staffing situation is really complex because there just aren't enough qualified staff to work for the program. And across the state, there's tremendous competition for early care and education workforce in part because the wages are so low. And, what we hear from grantees is that they're competing in some cases for, staff are leaving to work at a big box fulfillment center. They're leaving to work at Quick Trip because the wages are comparable and the stress level is lower. And so particularly in rural parts of the state where there's just fewer people to work there, that really creates a ripple effect in a community because you end up with classrooms that can't open because there's just no one to work in those classrooms. I think there's several other pieces that are going to really impact. Let me rephrase that. When I think about rural Wisconsin, we already know that there's childcare deserts across our state, particularly in rural Wisconsin. And a childcare desert means there's many more children than available slots. And in many cases, Head Start is one of the only licensed providers in a rural community. So if Head Start is facing a loss of staff, a loss of classroom availability, that really dramatically impacts access for kids and families in those rural communities. So, any loss of access is just really profoundly felt in rural communities because there's just not other options. And, I think it's important for the general listener to know that the majority of Head Start families and Head Start is serving almost 13,000 kids and their families. The majority of those families are working families, where one or both, if there's two parents in the household, those folks are working, or they're in education programs or job training. And so if those families have no safe option for their children, it gets harder to get to work. So any loss of care, again, has a profound impact.
Mm-hmm. And then, right now, all of this is just a proposal. These changes, haven't taken effect. But, there certainly has been some changes in terms of, staffing at the federal level for the Head Start program. Have you kind of heard from any association members about how that's been able to impact the work being done in Wisconsin?
Yeah, definitely. I think kind of contextualizing this notice of proposed rulemaking with sort of the start of this federal administration, the second Trump administration here, what we've seen since January of 2025 is really an ongoing erosion of the Head Start program through both big and small strategies. So right at almost the second week of this federal administration, there was a federal funding freeze where programs were not able to access their grant money. And for folks who aren't aware, when you get a federal grant, particularly the Head Start grant, you're not given like a lump sum of money. You need to be submitting invoices through a federal system, and you can only draw it down for short periods of time. So not being able to access your funds is like you're not getting paid for the last couple of weeks of work. So when your mortgage comes due, it's incredibly stressful and difficult to navigate. So we had a federal funding freeze where programs were not able to access their already authorized funding. Then we had in April of 25 a huge contraction of federal workers at Health and Human Services, which is the federal agency where Head Start sits, and a loss of Region 5 staff. So Region 5 is how they organize us federally, Head Start grantees in Wisconsin federally. And so there was a huge loss of staff that support Head Start. And when I say support, it's really like grant monitoring and compliance. So these are the folks who are processing the application for your grant renewal, the folks that are processing the your grant compliance documents. So there was a huge loss of that staff and a huge loss of institutional knowledge, which has really led to things dramatically slowing down at the federal level. We're on, I don't even know how many months. So there's a competitive grant process. And if a grantee is found to have some deficiencies, is the technical term, there's a process by which they typically would get a new competitive grant announcement, and those have been delayed. I think that the announcement was supposed to come out spring of 26, and there is no word on when that new announcement will come out. So things have just slowed to a crawl. So those are all, just for a general listener, trying to imagine that, you submit documentation for, again, a mortgage, and then they say, well, there's an indeterminate amount of time for you to wait to hear about that mortgage. So what do you do? Things have really slowed down, making it harder for grantees to operate. And in May of 2025, there also was a threat for Head Start to be completely eliminated. There was a leak of the president's budget, and it included totally eliminating Head Start. So what we've seen is huge attempts to dismantle Head Start. I kind of liken it to a Jenga tower, where they've made attempts to totally put over Jenga tower that is Head Start, or they have, attempted to pull out foundational blocks that destabilize it. And, kind of coming to our current moment that we find ourselves in is I really see this NPRM as an attempt to take out a foundational piece of that Jenga tower. It really, if this rule comes to fruition, I believe it will dramatically impact Head Start for the worse. One of the things, again, they talk about flexibility in this proposal, but then if you read the impact analysis of this proposal, they talk about that in order to make to meet the claims that they're including about serving more kids, it's on the backs of paying workers less, cutting workforce, and reducing hours for kids who, again, these are working families who need care so that they can go to work. So when you look into their own impact analysis from ACF, there's a quote, the reductions reflect required reduced instructional hours and associated staffing time. So they're saying you can be flexible, but their entire analysis stems on cutting services, cutting wages, and cutting comprehensive services for kids and families.
Mm-hmm. Well, Jenny, we've covered quite a lot of ground here. I was kind of wondering, public comment is still open till October 6th, I believe. Is there anything else that you want people listening to know about these proposed rule change?
Yeah, I think that everyone in Wisconsin should be concerned about the state of early care and education or child care in Wisconsin. Working families are Head Start families, and if we want our coworkers, our folks who are working in our communities to be able to get to work, this is a problem for the entire state of Wisconsin. If we see a contraction of Head Start services, if we see diminished quality of Head Start services, these are kids and families in our communities. And so I think this is a great opportunity for folks to comment, and if you don't have the link, so you can include that. I really encourage everyone to comment on this and to get involved and to check out our website and follow us on social media, because we've been alerting folks to these proposed changes, and to get informed, because there's a fair amount of rhetoric that's associated with this proposed rule change. But what we know is that it's really seeking to deteriorate quality and to deteriorating access and for kids and families. So to comment and follow what's happening, because we need quality early care and education. We need quality Head Start in our communities.
Thank you again to Jennie Mauer and to you, the listener. For WisPolitics, I'm Megan Woolard, and this has been Capitol Chats.